We are on our way
We're gonna get into a car crash is what's gonna happen.
to our first ultrasound appointment. Hello, lovely people of the world.
Magandang araw sa inyong lahat.
안녕하세요, 여러분.
Ahlan na sahlan.
Justin and Sarah.
We're back! Barely. Okay, you guys, so as you can see from the title, today we'll be talking about my week 8 pregnancy update. And the reason my hubby Justin here is joining us is because we had an ultrasound, our first ever ultrasound done. Our 8-week ultrasound was done this week, so I figured he should join us. You know, I'm sure he has a lot of input to contribute to this video. So here we go. Okay, guys, so today is June 7, 2018. I'm good. That goes to answer my first question, how far along? So today, baby Park is 8 weeks and 6 days old. Actually, yesterday, June 6, 2018, is when we went for our first ever ultrasound, which is our 8-week ultrasound. They call it the dating/viability ultrasound. That's when they figure out your due date, correct? That's when they figure out your due date based on the size of baby Park, and that's when we also figure out how old baby Park really is, as opposed to when my first day of my last menstrual period was. So yeah, so according to the ultrasound, the sonographer yesterday, baby Park, who I calculated was 8 weeks and 3 days old, actually moved to 8 weeks and 5 days old yesterday. So because today is June 7 and baby Park is 8 weeks and 6 days old today, the new turnover day is on Fridays. That's going to be a change for me. But I am going to continue with checking my weight every week on Monday mornings. Second, what are my symptoms? So my symptoms for this week, 8 weeks, includes, let's say, number 1, nausea. Oh no. The dreaded nausea. You know how I was like so proud. I'm like, yeah, I never, got sick, or I don't feel pregnant at all or whatnot. Yeah. So this week I started feeling a little bit of nauseous, but not throughout the day, not to the point where I've thrown up. Oh, knock on wood. I hope I never have to throw up. But yeah, and the nausea only kicks in weirdly at night. It's like everything pregnancy symptom-wise for me so far has been kicking in at night. So like at night is when I get bloated, uncomfortable. All the usual previous symptoms still exist, like the fatigue still exists, runny nose, sneezing, increased mucus production, my nasal passages, coughing up, clear phlegm, lots and lots of it, and all that stuff. I would say my shortness of breath actually subsided, so yay, no need for my Ventolin puffer or inhaler anymore. But yeah, definitely slightly nauseous at night. Slightly. Symptom number 2, burpy throat. Again, only ever happens at night. Thank goodness it's only at night, because then I don't have to suffer while I'm at work during the day or before I go to work for my evening shift during the day. So yeah, burpy throat. It's like, so I don't know if you guys have seen our previous videos, but I don't burp. I just don't do it. If I do need to expel gas, it goes out the other end, which is Justin's favorite scent, isn't it, honey? But then the burpy throat feeling was kind of like a bubbly, gassy feeling creeping up towards my throat, and I just couldn't understand it. It like literally starts here, works its way up there, and I just have to burp it out just a little bit. It's weird, and that doesn't help. I think that kind of is associated with my nausea as well, so yeah. I noticed that if I eat something salty, or even just salt, I remember one time, honey, just give me anything with salt, so I just dipped strawberries in salt and that's it. Good to go. Symptom number 3, decreased appetite. Yeah. So because of the nausea that kicks in at night, which actually is the worst at night, it does kind of lurk every once in a while in the afternoon, so I get decreased appetite. I don't really eat as much. I notice when I eat too much, I don't necessarily feel nauseous, but I feel really bloated. a lot of buildup in my tummy and just very uncomfortable. I get really sleepy, so I'm like, okay, I'm not gonna eat a lot then. But then I find that if I don't eat as frequently during the day, even if it's just little, excuse me, there we go, burp, little snacks throughout the day, then I find myself feeling really nauseous. But yeah, not to the point where I throw up or feel like throwing up. Thank goodness. I hope I never have to experience that ever again. Ever again, like I ever did, like ever. Just my sister warned me. She's like, oh, just wait till you reach the 8th week or the 9th week. That's when you're gonna feel all the most horrible first trimester pregnancy symptoms. Yes, the most dreaded symptoms. Because that's it for me for symptoms, really. That's all that's new. The rest is the same as last week. The fatigue, sore boobs, extreme thirst, frequent urination, all the same thing. Third frequently asked question, total weight gain. So for the 8-week mark, I gained a total of 1.2 pounds. Mind you, this was on Monday, June 4th. The one I had weighed myself. So this was kind of before the nausea kicked in. So I'm just like basing off of what I ate, I guess, on week 7, which led to my weight gain of 1.2 pounds. So yay! That's awesome. And they say it's normal to kind of either maintain your weight or just lose weight during your first trimester, because, you know, that's when women tend to have all these dreadful first trimester symptoms such as nausea, morning sickness, fatigue, all that stuff, decreased appetite. So yeah, totally normal. So I'm just happy I'm gaining 1.2. Yeah. Fourth frequently asked question. Frequency. 4 frequently asked questions. Number 4. Skin issues. Am I breaking out? I am breaking out. I'm breaking out here. I don't know if you guys can see.
Why can you include skin issues as part of your symptoms?
It's just frequently asked questions. Honey, I'm just trying to have more frequently asked questions. I'm already narrowing it down. Just let me have this one, okay? I've been breaking out here, along my hairline. One here above my eyebrow. Can't really see it, dude. I got makeup on a little bit. And yeah. Some people say that they break out on their chin. I haven't had that happen yet. Yeah, I just have one here. But that's pretty much it. No, I don't have any stretch marks. What else? Darkening or cloasma. Is that what they call it? Cloasma. Like the pregnancy mask. I don't have that. I'm already dark as it is, y'all. And then, yeah. No other skin issues so far. Except for like the usual as last week and the previous weeks. The itchy skin. Still get that. But I noticed by using a really good moisturizer, or even just any lotion really, keeping my hands moisturized helps a lot. So yeah, highlight of this week.
We went to see our baby Park.
Yep, first ever ultrasound. That's our highlight of this week.
Check out this video of when we went to a radiology lab to get our ultrasound.
Yay!
June 6, 2018. We are on our way.
We're gonna get into a car crash is what's gonna happen.
To our first ultrasound appointment. It's 12:13. I'm taking time off from work.
The whole day?
No, just my extra long lunch hour. And she has her day off and she keeps her from home, alright?
Well, not really. I had another appointment at 10:30 that lasted half an hour, and then I went over to Shireen's place, Shu's place, and had some lunch because I didn't have a proper breakfast. But yeah, this is the first, what they call the first dating/viability ultrasound that they do during the first 8 weeks. So I'm exactly 8 weeks and 3 days pregnant today on June 6, 2018. My sister warned me about this. Thank goodness she's been through it before I did. She said that it's possible that if they don't find anything or they can't see the baby using the abdominal ultrasound, they're going to try the transvaginal ultrasound. So I'm like, what? I've never had anything inhuman inside of me down there, so oh my god. Which rudder?
Inanimate.
Inanimate. What are your feelings, emotions, violent reactions?
Excited to see our baby. Hopefully they can see a heartbeat.
for sure you have to see a heartbeat by 8 weeks. It's usually the 5 weeks or 6 weeks where they might not be able to see a baby's heartbeat, but they said 8 weeks is a sure thing. So he's excited, but I'm anxious and super nervous because I feel, oh my god, just the fear that I might not see a heartbeat. Oh my god.
Well, if we don't see it today, we'll make another appointment. Hopefully, in the next appointment, we'll see it.
But from what I've read, we have to see it today. If we don't see it today, it's most likely nothing's right. I know there's something wrong with the baby. So, baby Park, here we go. I'm so scared. The things they're gonna do to me. They're probably gonna check my blood pressure and go like, "Whoa, that's high." I actually had a dream last night about. So I've been having crazy dreams, really, but they said that's expected during pregnancy, especially in the first trimester. But yeah, I had a crazy dream that I went to the appointment and they were checking my blood pressure, and it was really low at first. When they rechecked it, it was on the higher side. I don't know why I dreamt that. And then they're like, "Oh, look at that! We can see the baby's face." And I'm like, "Really?" And they had a special equipment that was not just showing the shape of the head, but somehow they could do like a 3D image of the face. And I remember saying, "How come the face looks so grown up and so old? Like a grown up, like a grandpa's face on a baby." I was like, "What the heck is happening?" It doesn't even look Asian, you know? Just like one of my senior clients. I was like, ooh. Crazy dream. I don't know. Yeah, we're so far, my love. Okay, you're gonna carry me there, right?
Of course. We just parked at our clinic for ultrasound radiology. And then we're gonna go inside.
You sure you don't want gummy? If you haven't eaten anything, we might be there for an hour. Gonna walk so far and I got no sunscreen on.
Well,
Oh,
what do you think?
I cried. So we saw the baby's heartbeat. Baby Park's heartbeat.
169 BPM.
Oh my god. Yeah, but I cried because I was like shocked to see from my very own eyes that there really was a shape of a bean on there. And then when she said head to tail, I was like, oh my god, this is real. It's
Head
really
to bum
something.
was 19 millimeters. 19.7
You're
millimeters.
just like, oh,
2 centimeters.
okay, cool. Oh my god, so tiny. But yeah, she said she could see the heart fluttering on the top. But I looked and I was like, oh. Any violent reactions, honey?
This little thing right here is the baby. Head to bum.
Yay. But I'm worried. I'm like, she told me I have 2 fibroids. I'm like, what? What are those? I know fibroids are like cysts, but they say that's normal. A lot of women have it, and it usually is benign. Like, it doesn't affect anything down there. And she told me that the biggest cyst that I have, or fibroid that I have, is actually the outermost layer of the uterus, so I shouldn't have anything to worry about. But you know, I'm like, so now I have to Google and research on fibroids and go like, what could possibly go wrong in the future? But yeah. She said she's 36 and she's 12 weeks pregnant, our sonographer, so. Oh, her name's Lindsay. I figured I'd want to remember her name because, you know, first ever ultrasound. Oh, and she predicted based on the height, I guess, or the length of the baby, that baby's actually measuring 8 weeks and 5 days.
And our baby's due on January 11th,
Woohoo!
2019.
Yeah, buddy. I bet you will come early. It's probably gonna be a New Year's baby. It's like, what?
January 11th, 111.
Oh yeah. I didn't think of that. Pregnancy apps that I had downloaded, they predicted that I was actually 8 weeks and 3 days. not 5, and that our due date would be January 14. So close enough. Although my sister said that the pregnancy apps predicted her baby would come out May 23rd, and the doctor said her due date was June 5. So if you ask me, since the baby came out May 24th, the pregnancy app was way more accurate. So, oops, drop baby. But yeah, there's baby park. So excited. So yeah, let's hope the dash cam is actually facing the right way. What about you, though?
I'm going back to work right now.
You didn't eat yet.
I'll eat when I get to work.
The trick is to keep a full bladder. Apparently, she said a full bladder helps with the ultrasound images, because the bladder is kind of located a little bit above and behind the uterus. So a full bladder would kind of help push the uterus up towards the abdominal wall. So it's easier for her ultrasound probe to actually find baby park. My baby park. So the old wives' tales say something about the heartbeat. I can't remember. I think less than 140 is something, and more than that is something. I think Shireen's first ultrasound, it showed that the heartbeat was in the 160s too. But based on old wives' tales, I think that's supposed to be a boy. I could be wrong. We'll see. Maybe I should Google it now.
Yeah, but she said, don't believe that it's not accurate.
Yeah, it's not accurate. No kidding. Look at these new moms trying to get some sun.
Is it gonna be you?
Apparently. But it'll be nice to see how each of them has a baby. So they're like baby buddies. I need to find one. I think I know who.
Aren't you supposed to take those classes?
No, apparently. So on these pregnancy apps, or even online, really, you could sort of put it out there that you're this far along and you're looking for a baby buddy, and then they will tell you in your community, like people from your community will actually message back and say, I'm also that far along and I also live in the Northwest, something like that.
Love at first sight.
Aww. How are you gonna focus at work now?
I love my baby.
You love your baby? Forget about me already.
We came home with this little photo.
Okay.
So our baby park is facing down. This is baby's head, and this is baby's bum bum. Facing down. Baby's rump.
They call it the rump. Okay, so next question, food cravings. Do I have any food cravings this week? No, actually no. I don't have any food cravings. So do I have food aversions? Do I, honey? Okay, let's be honest here. At night, every night I take a whole bunch of vitamins because I took my doctor's advice and my sister's advice, which is that somewhat like the prenatal vitamin causes constipation. Luckily for me, I don't have that yet. Oof. But yeah, so they advise that I take it at night. So Justin here every night prepares a bowl of my prenatal vitamin, my iron supplement, my salmon oil supplement. So those are pills that are easy to swallow. But then he also prepares gummies. So we've got calcium and vitamin D combo gummy. And then we have the hair, skin, and nails gummies. And then we have the vitamin C chewable tablet. So what I noticed about this week is I have had to skip, I think, 3 days. 3 days! Well, I took my prenatals, I took, all those pills that are really important, like the salmon oil supplement, iron supplement, and my prenatal vitamins. I took those kind of struggling, but I did take them. But then I asked Justin and I begged him, I'm like, please, can we just skip the gummies, please? So I guess that would be counted as a food aversion. I just couldn't get myself to chew them. I couldn't get myself to swallow them. I tried to chew really fast and swallow them down, like gulp them down with water, but no. Then I get really nauseous afterwards. So it's like, I'm just gonna skip them, please. It's so weird. It's the smell of the gummy that makes me not want to go anywhere near them. What is my mood like mostly this week, honey? Happy or moody?
Happy.
I had to look at it for that. So of course we're happy this week because we had our first ever look at our baby. Baby's heart was beating, which is that's always my fear, is like his baby's heart beating. But yeah, baby's heart was beating. Okay, so final question. What am I looking forward to, or what are we looking forward to, honey? I'm looking forward to, I have a blood work booked for next week. I'm looking forward to that because I'd love to find out where my iron levels are with this pregnancy, because I tend to have really low, not really low, but borderline low iron levels, which is why I'm taking iron supplements for years, really. But yeah, I've been only taking 300 milligrams one tablet for those nurses out there who are interested. But anywho, that's pretty much it. I'm looking forward to that. I mean, it'll be cool because it'll be taking a lot of, what do they call it? They call it the first trimester screening blood work. That's what they call it. Where they'll be taking, I think, 3 separate collections of blood samples for different reasons. So yeah. That's good, I guess. I mean, I'd love to know where my cholesterol levels are at, my blood sugar levels are at. Look at this boy. He's my mascot. See how he talks too much? Like, I don't know what to do with him. I'm like, where's the mute button on this guy? He talks way too much.
Sorry, I talk too much.
Yeah, at least he apologized. That's good. That's good, honey. So yeah. For those of you who don't know us, for the previous videos when I went like, yeah, Justin talks way too much, so I had to take him out of the shot. This is how he talks. So yeah, had to take him out of here. What else do I have to say for you guys? Well, that's pretty much it for week 8.
Goodbye, everyone. Thanks for watching.
Hope you guys enjoyed this video. So for those of you who haven't subscribed yet, please hit the red subscribe button below. We'd really appreciate it. And send us a few thumbs ups if you like this video, as well as please do continue to share your comments in the comment section below. Let us know for those mothers to be as well, or those who have had experience in pregnancy. Please do share your experiences with us about your 8-week ultrasound or your first ever ultrasound. How did that go? Did it go well? Did it not go so well? Like, I love to hear all your stories. So yeah, thank you so much for watching.
Bye, everyone.
Mwah. Love you.